if you're new to this SIG meeting and you haven't let us know, you haven't sent us your name and affiliation, we would appreciate if you could do that. If you could send it to Robin Fielder, and her email address is on the agenda. And part of what we use that for is to make sure that you are on the PCBH listserv, so you can get you'll get the updated agenda and meeting items that for the SIG that CFHA in general doesn't get. Any other administrative things, Jeff, before we go to the listserv update from Robin?
I don't think so. Just a reminder to everyone that in contrast to the last meeting where we were trying something a little bit different, we do want to encourage people to chime in as we go along here. As if there's something that you want to ask a question about or comment on as we go through these topics, we hope you'll feel free to. And then we will have, if you look at the agenda, you'll see that we do have some time at the very end of the meeting too for just other discussions. So we're going to go through these topics, and then we'll open it up for just other topics, other concerns or issues at the end. So, all right. Do we have anything, Robin? Robin's one of our secretaries, our co-secretary, Robin Fielder. Any items on the listserv there?
Just that we've transitioned from the broader CFHA listserv that we were using initially to the PCBH SIG listserv. So hopefully everyone's been getting those emails. We sent out the announcement about this meeting and a reminder today. I also sent out an announcement about something at a conference that might be of interest to the members. So hopefully everyone's getting those, and if not, please let me know with an email to robin.fielder@va.gov, and I'll be happy to look into that for you.
Jeff, before you get started,
Very good. All right. So,
Jeff, but before you get started, it looks like some people have joined us after we made the initial announcement about muting and unmuting. So, do you mind if I just remind people of that one more time?
Go for it.
So I will administratively be unmuting all of you, but we're asking for everyone on the call to go ahead and mute yourselves via your computer. In your navigation bar, there's a little green button, and you can mute yourselves on the computer. So some of the background noise, if you all are hearing background noise, if you'll take a moment and look and make sure that you are muted, we'd appreciate it. Thank you.
Great. We may have to remind people a couple times during the call.
Right.
Okay, so next item is an update from Jennifer Funderburk about what's going on with the webinar work group. We've got a few different work groups that are formed already or are forming, and there's already just a lot of activity going on. So Jennifer, you want to talk a little bit about what's happening with this group? I see she's, wait, is Jennifer, yeah, Jennifer, can you hear us?
Polly, is she signed in?
Looks like she's signed in.
Yeah, she's signed in.
She has unanswered questions.
Okay. Let's see.
Jennifer, you have to hit your mute button.
It says she's trying, but it won't let her talk. So let me, Jennifer, on the telephone and mic and speakers button, can you make sure, it looks like you're using mic and speakers. Can you make sure that that's clicked on your navigation? and maybe it will let you in.
I was commenting the other day, I liked that the slogan for GoToWebinar is "Webinars Made Easy," because it seems somewhat ironic, but maybe that's just me.
Okay. So Jennifer, if you're using the telephone line, this is showing that you're using mic and speakers. So I think that that's part of it. She's going to try a different way. I wonder if we can go on to the next agenda item.
Yeah, that's what I was thinking.
While Jennifer's doing that.
Yeah.
Sure.
Hello, can you hear me now?
Yes.
Yeah.
Oh, great.
Jennifer?
Okay, something to know about webinar is that when you're calling in on the phone, you have to enter an audio pin that you can only see if you click telephone at the top of your webinar.
Ah.
So learning lesson. My computer doesn't have mic and speakers, so sorry to take so long. Update from our webinar work group. So we are looking for members. If anyone is interested in joining the webinar work group, our goal is to identify individuals who are willing to share topics of interest through webinars and to put those together in an organized fashion for CFHA members. And we will be, it's a very nice group of people, so hopefully if you're interested in kind of the idea of teaching or sharing about, you know, clinical interventions useful in PCBH or how to set up a PCBH model, I think, you know, obviously those would be topics that we're going to try to put together webinars or identify people who have already put together presentations. And that is the second point of me talking today is to, I had an email out on the listserv last week requesting that if anyone has any presentations or webinars that they've already created on a topic surrounding PCBH models that they are willing to share, if they could email me and the idea or the presentation topic, because we're hoping that there are some that are already kind of pre-made that we might be able to take advantage of in kind of identifying some to roll out more quickly than maybe some others. So.
And the other members of that group, Jennifer, it's, let's see, it's just to give a shout out to them. I believe it's Leslie Manson Wright and Shonda Wells, Michelle Wine, Randy Dublin. I think those are the, did I miss anybody?
I think you got it.
Mm-hmm. Yeah.
Yes, unfortunately, I'm trying to find their names because we have never met in person, so I'm horrible with names as I...
I'm pretty sure, I think we got everybody there.
There's only 5 of us right now, so if other people are interested in joining us, we are more than welcome. We are a very welcoming group, and we are just now starting to set up like the structure of our group as well as when we're going to meet, so you could get in on the ground up. Great.
Great.
I think that's all for me.
So next on the agenda we have the social outing for the SIG at the CFHA conference that's coming up. And I see that Randy is on the line. Randy, do you have any comments about how this is shaping up at this point?
Everyone can hear me?
Yes.
Yep.
Okay. Well, yes, I've had 2 people show their interest in joining the committee, so thank you, Alana and Neil. And if anyone else would like to help me, there will be more updates as we get closer to the conference. but this should be a great opportunity for us to put faces and names together. And if you're interested in joining the group, please send me an email. We'd be happy to have you join. And if anyone has any ideas about good social opportunities for us to meet at that conference, I'd be happy to hear your ideas.
And I'd like to say that in past conferences, there have been various different social outings, both formal and informal. And I think on my experience, it's been a really nice way to start to put a face with a name and to be able to kind of sit down, hopefully in a relaxed atmosphere, and be able to have fun, have good conversations, just really get to mingle with a variety of different people. So Randy, I'll be looking forward to seeing what you put together on that. And as we get closer, if you need any additional help, I'm in the local area. I live in Arlington, Virginia, so feel free to call on me if you need any extra push at the last minute.
Okay, great. Thank you.
And my thought would be, I don't know what everyone else is thinking, but I think that an evening event, like a dinner event, would be the best way to go. I mean, we could try to do something during lunch, but I think it would be more fun and would give us more time if we could, organize something in the evening.
Yeah, the ones I'm talking about have been in the evening, and I think that those do work the best. They don't interfere with people's conference plans, and it just gives you an extended amount of time to spend as little or as much time as you want with your colleagues.
Yeah, right. Sounds good. Anyone else have any input on that? Anyone bold enough to try the unmute button? If not, we can move on. We can move on to the development of a PCBH toolkit. So, so this is an idea that we've talked about at the last meeting as well. And we've had some people who have expressed interest in putting this together, but we haven't actually met with this group yet to kind of start more formally organizing. We're going to be doing that on April 9th. We have a meeting with the 4 people who have volunteered: Juliet Cutts, Don Prentice, David Bauman, Neil Morris, and get things going more formally. So we're still looking for people who are interested in participating in this. So if you are interested, go ahead and email Robin. Her email address is there. But the basic idea of this toolkit is that we would have a lot of information on our SIG website that would pertain to this model that would be helpful for people. So practice tools, reading lists, different training programs that exist out there that have to do with PCBH care and so forth. So, I mean, lots of different ways that this could go. Lots of different things we could do with it, but it would be sort of a repository of tools and information for people who are kind of a go-to source of information for people who are interested in PCBH care. I know at least 1 or 2 of the folks who are interested in this committee are on this call, so I don't know if any of you all have anything that you want to add to that. If so, chime in, or if anybody else has ideas that would be good for the toolkit committee to be thinking about. Any comments?
Hey Jeff, this is Leslie. Oh, can you hear me?
Yep.
Oh, hello?
Yep, hello.
Oh, hey, this is Leslie. I'm just chiming in to say what I've said before was I think it would be great to get all the different toolkits that are already out there and review some of those to see if we want to post some of those on the website as well. instead of redoing the work.
Mm-hmm.
Yeah,
Yep.
absolutely.
And I think
I think part of what we want this group to do is to look at what's already out there, and we don't want to reinvent things, but we can certainly be a conduit, because I know that a lot of people there are different websites out there with some great tools on them that people have spent a lot of time and effort putting together, and if we can be another gateway for people to reach these already well-designed toolkits, I think that's part of our mission as well.
absolutely. I think most people, who are on this, who are in this SIG, are already busy enough. None of us need to be developing things that have already been developed. So that's definitely, I think, going to be part of what we try to do, is to just pool together materials in many cases that are already out there.
Hey, Jeff.
Mm-hmm.
This is Naftali. Hello, everybody. I would also just add, I think these are tremendous ideas. I'm so glad people are interested in working on these. Part of the toolkit, or one way to organize it is in the form of not just like links to other things, but like a frequently asked questions kind of section that gets developed over time. Because I know, like on the listservs, you'll get folks asking very similar questions over time. It'd be great to be able to direct them to kind of a centralized place where a lot of these questions have been asked, with relevant links and things like that, as a first step for people to get to them.
That's a great segue, and that's next on the agenda.
Oh,
Actually, Naftali, I think in the very first meeting that we had, I think you suggested that, and then we went on and it's something that we're working on developing.
Cool.
So yeah. So we'll put you down on the committee then. That's what happens when you speak up.
Yeah.
Yeah, that is next on the agenda. I don't know if anybody has any other comments or thoughts about the toolkit, or if we should move on to the next item.
Going. So the development of the frequently asked questions section, it looks like, Suzanne, it looks like you're on the line.
I am. Can everybody hear me?
Yes.
Okay, great. Well, I'm so glad that Naftali is going to be on this committee with me, because now it makes it a committee of two. So clearly not the sexiest committee to be on, but I'll tell you what got me to sign up, and then maybe other people will think, wow, what a good idea, maybe I'll sign up too. I thought, well, I have a lot of frequently asked questions that go through my head, or that people ask me, and if I was on this committee, I would know the answers to those frequently asked questions, because that's going to be, obviously our charge. It's not only to gather the questions, but to answer them. So that was what inspired me to think this would be a great committee to be on, because I thought I would both, enjoy working with people on it, and also I would learn myself. So Naftali and I are looking for more people to join the committee, and I guess I was just conceptualizing it as that, as looking on listservs that other people have, or thinking about questions that have come up that we've all been asked, and trying to either guide people to other resources that have already answered those questions, or maybe to answer them in a way that we think speaks more directly to a PCBH model that we're, trying to conceptualize or kind of operationalize here. So I hope other people, and once we get, really, Neff, you are the only other person that's expressed any interest, and I'm not even sure that you really want to do it. But once we get more than me, then we'll go ahead and start meeting and kind of working our way through, a list, and start posting little by little. I see it as something that grows over time, and not like, we're going to wait for 50 questions and then just sit down and answer them. We're just going to, as they come up, kind of build a list over time. Any other thoughts on how we might approach it? That was my own thought on how to approach it.
I'm on board. I'm game to work with you, Suzanne. Now, this is something I deal with a lot, so I'm happy to work with you, as usual.
Great. Thanks, now.
And I think the way that, oh, go ahead.
Oh, this is Lori Zeman. Suzanne, I was going to tell you I'd be happy to be on the committee with you guys.
Oh, great. That's great.
You're growing exponentially.
Oh, what were you going to say, Jeff? I don't know if you got interrupted.
Oh, I was just going to say that I think the way that you laid it out there, you know, kind of your plan, your vision for how to develop this sounds great. And I really like the idea of just having a concise, you know, sort of resource right there that people can just go to with the most common questions that we all hear when we're talking about this at conferences and so forth, you know, just a really quick reference site for folks. I think
it might be a nice way to give people kind of an elevator speech, right? So we can not only get on the list to get the answer, but I'd like it to be to get the answer in such a way that you could then communicate it to someone who knows nothing about PCBH billing, you know, not so much the technical answer as much as an answer that could be used to publicly explain X, Y, or Z. So.
I think we can leverage technology, you know, in kind of a wiki type format, so that a lot of the questions do evolve over time. So these are not necessarily static issues, so that it's updatable, you know, pretty easily. So I think that we can leverage technology in that way to make sure that's a live, kind of more of a living document, but again, brief and very you know, pointed and not something that's, you know, basically another dissertation people have to read through.
Great. Well, I guess we can set up our first meeting. So I will, Robin, maybe you can just send me, like, anybody that says they want to be on it, maybe send their name to Robin, and then Robin, you could send me an email, and I'll go ahead and send out like a couple of dates or a doodle or something.
Yeah, I'll send that to you, and we'll send the minutes out after the meeting, and then we'll see if anyone else expresses interest, and I'll send you the names and emails.
Thank you. And thanks in advance for all the people that are as excited about this as I am, and as Neff is. All right.
Yeah, thanks for getting everything going on that. It's great. All right, so next item then is opportunities for collaboration. So is Danielle signed in here? Let's see. I don't see her signed in. And I don't actually know what she was planning on talking about. Interested in job acquisition and program development proposal. Does anybody else know what that's about? Feel able to comment on that?
This is Ebony. She spoke about that at the last visit.
I'm sorry, go ahead.
I was going to say she spoke about it at the last visit, talking about how she went from getting a job with, you know, with BHC, and also how to get it up and running once you have the job, and she was looking for more individuals to perhaps make a presentation, if I'm not mistaken, maybe at CFHA or another outlet that way.
That sounds familiar. Yeah. So I guess we could just leave it at that then. If that sounds like something of interest to anyone, then you see her email there and contact her. And then, you know, we just want to encourage people, if you're interested in finding other people to collaborate with, feel free to use the listserv to drum up other members to work with you. I think it's become clear that there are a lot of people who are, able and willing to help out with projects. So I've seen a few things going around on the listserv already, which is great. Are there any other new projects that people have in mind, sort of, that you're either dreaming about or you're actually starting to implement, starting to work on, that you'd like to either just announce to the group and just to let us know what's going on, or something that maybe you'd like some help with or like some input on? Anything anybody wants to comment on?
And then there was the vast sea of deadness.
I'm imagining that, everybody's just trying to figure out how to unmute themselves, So all of a sudden we're going to have a flood of people.
If you all are trying to unmute yourself and you're having difficulty, please write that into the chat so we can figure out what the problem is. You should be able to go and just click that green microphone button and unmute yourself. Some people can mute themselves directly on their phone. That's another option. And as you can see, we've been progressing and making the actually webinar experience hopefully better and better as we go. But we want to work out all the kinks so people can participate in an open and easy manner. Despite the fact that this is supposed to be easy, it has proved not to be so. So really, any other comments or discussion about anything? Ways that you want to see the SIG move, directions you want to see us move in, anything.
Can you hear me?
Yes.
I can hear you.
Okay, just checking.
It works.
I'm not sure I have a thought at the moment. I mean, I have a few, but not relevant.
All right.
I have one thought, actually, something I would like to talk a little bit about, which is we don't really have anything that is geared toward outreach, and dissemination, kind of getting PCBH information out to other organizations, even other disciplines. I mean, most of the people on this call, I believe, are psychologists, and so just ideas for how we might reach out to other organizations. That's something I'd like for us to work on, but I don't know what ideas people have. Maybe conferences that people, are thinking are good places for us to, sort of non-traditional places for people who practice PCBH to give talks, do workshops, do posters, or even just attend.
Well, Jeff, I think this goes to kind of probably a longer-term issue around essentially branding the subgroup. Are we calling this a special interest group? Is that what we're calling it?
Mm-hmm.
So, and I think as folks go around, doing presentations or interacting at other conferences, I think of other places like obviously APA or Society of Teachers of Family Medicine, or SBM, that there's some way that we could over time create some branding around this special interest group and around the model itself, that we could use that branding when we do those presentations, whether it's a slide that introduces the special interest group for interested people if we're doing a presentation, obviously a web presence on CFHA's site would be helpful, I think, just to kind of give the group some sense of identity, and then it gets a little bit easier to form relationships, I think, outside of our our circle.
Mm-hmm. Mm-hmm.
Hi guys, this is Polly, and actually I'm talking for Randy Dublin, who is having some difficulty getting unmuted, but she said that she heard the American Psychiatric Association was having a meeting this Friday about PCBH, and suggested that we contact them. I did see that they were doing some sort of live broadcast, I think, on Friday morning. Are you all aware of that?
Mm-hmm.
Okay. I think that went out to the general CFHA listserv.
Yeah, I think so.
So I have a question.
So one idea. Oh, sorry. Just to summarize. So it sounds like one idea would be to try to reach out to the other APA and then maybe doing a webinar or something on the general CFHA site, just to reach out to other CFHA members who are not a member of this SIG. And anything else there that so far that ideas?
Well, Jeff, I think what I was saying was, I think before we get to that point of necessarily reaching out, I think some sense of, when I mean branding, I'm talking identity. So I think that some, some kind of way in which we can easily communicate who we are and what we're about. I'm just thinking, like, if you're on a team, you wear a badge, and that means you're on that team, so to speak. That kind of thing helps facilitate these kind of relationships, because otherwise it gets a little bit fuzzy when you're talking with other people and they're not sure who you are or what you're representing, or what your deal is, so to speak. And so I think that'll happen over time as this group coalesces and as we develop that identity. But I think it's going to take some time for us to kind of figure out what the best way of essentially promoting PCBH is.
Makes me, when you mentioned the badge, it just makes me think, one simple thing that we could do is just have T-shirts at the conference. If people were interested, if you're a SIG member and you want to kind of advertise the SIG, and so yeah, that might be one thing we can do. I'm assuming you're thinking a lot more broadly than that, but just as an initial concrete step.
Yeah, yes and no. Yeah, I think I am thinking broadly, but those small steps actually I think are important to again, just to define what your interest is more clearly than just integrated care in general.
Yeah.
And Jeff, depending on kind of what the conference committee would allow us to do, T-shirts certainly are nice, but cost a lot of money and are a relatively big production. But something as simple as being able to have a tagline that goes on the at our conference, the CFHA badges that say, primary care behavioral health SIG, ask me about it. And that way it could be promoted just at our conference in general. But, for other people that are giving presentations at other places, we could come up with and which is part of what we talked about for branding, come up with our own PCBH logo and maybe a tagline that goes with that logo that might parallel kind of what CFHA has, but with our own SIG, and encourage people to ask what that is. Could be put at the end of presentations, or and it's just a kind of pretty straightforward and easy way to kind of get the word out that there's another group who's specifically focusing on this model of service delivery, and if somebody's interested in it, they might want to pursue it, and they can come up and ask questions, things like that.
Yeah. Maybe we should have a another committee, another work group on this that's like an outreach work group. What do you all think? Would it be worth trying to organize that? Anybody interested in participating in something like that? So coming up with ideas like, like we've been talking about here, just for branding and also for outreach to other organizations. You could develop an I Heart PCBH badge that everybody could wear around. Let's.
I vote for bracelets.
All right.
So it sounds like we can keep this as maybe kind of a running topic, and I think especially as some of our other groups get up and running, we can probably certainly revisit this, and we could, we can certainly talk offline with Polly and the rest of the committee to see if at least at our own conference, if there's another way where we could sort of get the word out about what we're doing.
Mm-hmm.
Yeah, and I was going to say, Chris, this is Polly. At a minimum, I think at the conference, and Leslie Manson suggested this, we do, as part of the identifying ribbons, for those of you that are members of the PCBH SIG, we can have an identifying ribbon that way. So we'll work on it, including that. But if you all have more creative ideas, we can certainly look at those options as well.
Okay.
That's great. So maybe we'll just put it on here as an agenda item then that we can revisit next month.
Sure.
Okay.
So I had a question about research.
Fire away.
Yeah. So is one of the things that the SIG is interested in doing is, exploring outcomes?
That's a pretty broad, general question. I mean, I'll speak for myself. I mean, I think I'm always interested in facilitating or potentially being involved with individuals or organizations that are looking at program evaluation, quality improvement assessment, and/or outright quasi or experimental research programs. And so, I think, we've got, Jennifer Funderburk's on the line. She's the co-chair of the CFHA Research Committee, and that's something that we talk about on a monthly basis and how we can be more involved with that. And I certainly see our group as, I'm on that committee as well. And so I think part of our mission, although we haven't specifically listed it here in our agenda or talked about it, would definitely, at the very least, to be in support of those kinds of things. Did you have a particular idea, Rusty?
Well, I'm just trying to, tee up a discussion with the other group, the research group, about, a research network, the CCRN or something equivalent or whatever. It's just sort of my way of asking this group the same sort of questions I, theoretically would pose to the research group, about whether, whether that is in the range of interests of people working on this group. In other words, if you look at the agenda, and I called, I joined late, so, but there's a lot of talk about identification, a lot of talk about toolkits about how to do it, talk about billing and legal issues. These are still all the sort of how to get it done, kind of aspects, which are all still critically important. But I just sort of asking the endpoint thought in the development of these, this model or any model, and that is, how are we going to look at its effectiveness, at its process variables, at its outcome variables, and that's why I just sort of bring it up generically, because one assumes that the practices with this model are a subset of all practices, right, doing collaborative or integrative care, and so I'm just pushing that agenda a little bit.
Yeah, so one of the things we might be able to do as a SIG is to take our SIG members who are either wanting to or who are actively looking at research or program evaluation or quality improvement types of assessment to kind of exponentially expand what they're doing in a way that might be parallel to the Collaborative Care Research Network, but maybe on a smaller level, is how can other practices that have SIG members on it, how can they become involved in either new evaluations or how can we start some evaluations from scratch with healthcare services that have the same kinds of goals.
Right. Right. I think that's sort of what I'm pushing.
So I'm interested in hearing people's thoughts on that. What do you think?
Well, I think one thing is that we should.
I think one.
Go ahead.
I was just thinking of a very practical example of the way this SIG could be helpful going forward. I'm sitting on a massive amount of data right now, hospital data in our community, and one of the issues I have is just capacity for statistical analysis, for example. And the way I envision this SIG potentially helping in the future is just networking to get resources, connections of folks who have better expertise, for example, in cost effectiveness analysis and just statistical methodology in general beyond what I can do. And so I think when I think about research in this SIG in particular, that's one of the ways that I think the SIG can be helpful, just by facilitating network among people who have like-minded connections. Because my efforts to connect, for example, more broadly and folks who do research in general, sometimes I found it to be a little bit fruitless because folks have such stratified research interests. And I really want to connect with people whose research interests are very well aligned with the goals that the PCBH model has. So I'm hoping that over time that sort of networking happens here, and from there those resources would be a lot easier to access than I've found them to be so far.
Mm-hmm.
Right. So not only could we specifically target that as agenda items, but I think the PCBH listserv is designed to help support you in exactly the kinds of things that you want to do. I mean, if you're looking to partner with folks that kind of look at the world through the same set of glasses and have research, data analysis expertise, that's something that I think would be great to put on the listserv and see who responds. I'm going to throw Jennifer Funderburk back out there again. As the co-chair of the research committee, I know that she absolutely has an interest in these kinds of things, and might even be able to connect you with individuals who might not be part of this SIG, but who would also kind of share the same interests. I mean, there are other colleagues she has in the VA that might be willing to partner with you as well.
Yes, and I am specifically throwing that feeler out there at this point.
So I think that's one thing that we want to make sure that we always do is, at this monthly meeting, is just if people are engaged in research, give them a chance to talk about that. If they're looking for people to collaborate with on a research idea, if they've got an existing database and they want somebody to come in and, try to do something with it, I think we want to each month just kind of revisit this topic and see if just throw it out there for people to volunteer themselves.
Right, so we can start to include that as a standing agenda item.
Mm-hmm. Mm-hmm.
Sounds good.
Yeah.
Thanks, Rusty.
Couldn't be silent the entire call.
No, that would be wrong and bad.
So we'll add a couple of standing agenda items then to future meetings. One will be outreach, branding, something like that. Another one would be research. All right. Great. What else? We've got about 15 minutes. We don't have to take it if we run dry, but other thoughts, ideas people have?
Well, I was just thinking as good behavioral health consultants, just because we have 15 minutes left doesn't mean we have to use them up.
That's true. Some people probably need to eat lunch out here on my time, so.
This is Robin. I want to say two things real quick. One is that I sent out an announcement on the listserv earlier today about a training opportunity that will be coming up at the Society of Behavioral Medicine Conference. Jennifer Funderburk and I are presenting a workshop on brief alcohol interventions for behavioral health providers. And the point of it is to help increase clinicians' knowledge and skills in how to integrate alcohol interventions with other clinical issues. So like if you have a patient presenting with depression or sleep problems or anxiety, but they also have risky drinking, how can you kind of work that brief alcohol intervention into the session? And we'll be talking about a brief intervention that can be used within the 15 to 30-minute session consistent with the PCBH model. So please feel free to ask us if you have questions about that. And then on an unrelated note, I just wanted to say if anyone is having technical issues with the phone or speaking during the meeting, you can email me and we'll try to keep track of those and problem solve those. If we're still having any unusual issues, we want to know about those. So let us know. Thank you.
But I do think it's better than it has been the other 2 months. I think, you know, we're moving in the right direction. And thanks to Polly for all your help with that too. One thing I would throw out there is I know a few people that I work with at HealthPoint, David Bauman, Bridget Beachy, Melissa Baker. They were on the call last month and were asking for people who might be interested in collaborating on a research project, and I think they've had a really great response. And I think they've had like 10 different people express interest. So I do think that, you know, just having discussion at this meeting and kind of asking for people to collaborate with is something that can help a lot. So encourage people to bring those ideas to future meetings.
So Jeff, I just want to give a thanks to Polly for helping to kind of get everything organized, to Robin and Ebony for being just outstanding secretaries. From my perspective, this whole SIG has been you don't know if you're just calling in, but a fairly labor-intensive lift over the last couple of months to get this going full steam and to make sure that everything's in place. And frankly, without the assistance of our secretary and Polly and her assistants, Jeff and I would just barely be keeping our heads above the water, if not sinking to the depths of the ocean. So just thank you so much for all your support. And I just wanted to let everybody know that a lot goes on behind the scenes to make this happen, to prepare for this. And we want to make sure that it is relevant and useful, and that it continues to grow and expand and serves your needs as we move forward.
Yeah, I couldn't agree more, and I'm glad you added that in there. I feel like Ebony and Robin, Polly, everybody is just putting in a ton of work and doing a fantastic job. So thanks to everybody, and thanks to all of you who are participating too. We've had a pretty decent turnout each month. So hopefully things keep moving forward.
Yeah, and you know, just as always, we're going to be recording these meetings, and so they will be available, and we will let you know. They'll be available on YouTube. We will send out those links as soon as they are available. We're going to continue to have this meeting the first Wednesday of every month. The next meeting is going to be on May 7th, same time. And if anybody has any questions about anything, this can go from meeting to meeting, please feel free to contact either myself or Jeff or either one of the secretaries, or feel free to post things to the listserv. We want this SIG to really serve your needs. So please let us know if we can do things better or differently.
Just a quick question on the agendas. I could have screwed this up, but I went to the place and found the minutes from the last meeting. It would be helpful that if the agenda could be sent out as well. I know it's on the screen, and if it was, then I'll just have to figure out how to find it. But if you send out the agenda ahead of time, because sometimes I want to move up and down on the agenda and you're not moving it, and I keep faking myself out and trying to move my mouse and realizing it's not my agenda, it's your agenda. And so if there's a way to send that out before the call, if it's available, then we can fool around with the agenda ourselves.
So we sent the agenda on Thursday along with the instructions for how to log on today. So just make sure you double check your email that way. But
okay. Who was it from? Was it from Ebony?
From Ebony Winford.
Okay.
But just so you know, going forward, we'll always plan to send it out a few days in advance with the login information. And then about a day before or the day of, we'll send a reminder that states, hey, here's the agenda, here's how we log in, just in case you missed it the first time.
Okay. All right. You're right. It's right here. My bad.
No problem.
I'll do better.
Anything you get from Ebony, anything you get from Ebony Winford or Robin Fielder, don't skip it.
Right. Yeah. No. I'm definitely. And now that I can find it, I'm sliding it back into my special parking place. Okay.
Perfect. All right. Well, thanks everybody.
Okay.
We'll talk to you all next month.
Take care. Bye. Yep.
Thank you. Bye.